sure many people are like, Miss Maki, did we hear you right? Like, so like we can actually come to the United Kingdom as a healthcare assistant without any form of health background? Yes, girl, you heard me right, loud and clear. This is because on 24th of December 2021, the UK government added the HCA, which is the healthcare assistant, to the shortage occupation list. That is to say, you can actually apply with no qualification at all, irrespective of your background. You can apply and be on your way to the United Kingdom via the health and care visa scheme. Girl, that is huge. So if you like the sound of that, please keep watching and don't forget to get your notepad because you'll be taking down a point or two. And please share my video, subscribe, and above all, give me a thumbs up. Thank you. Hello again, welcome to my YouTube channel. My name is Maka, but you can call me Miss Maki. If you're joining us for the first time, you are welcome. And if you're a returning subscriber, thank you guys. You know how we do this now, so just come in and take a seat and let's roll. So now back to the topic. Who is a healthcare assistant? A healthcare assistant is someone who takes care of patients in a hospital, care facility, or care homes, as the case may be, or a patient's own home. Their activities include taking care of patients' day-to-day activities, assisting nurses when necessary, assisting with medications, and many other things as might be laid out by your employer. Now, what is the entry requirement? It's very simple. The UK government has said it explicitly that there's no qualification, because I've gone through a whole lot of job advertisements, and basically what they want is, if you have qualification or certification, that's a plus, but if you don't, good and fine, because you obviously be trained. And then the most important thing is that you should have a grasp of written and spoken English. You come to a foreign land, so you can't come to a place where you cannot communicate in their normal English day-to-day language, because how do you attend to people? So you at least should be able to write and speak English. That brings us to the Ielts part. Some agencies require that, while others do not, but then we'll get more details about that, whether you need Ielts to apply for this position or not. But for now, keep watching. So I know many of you have so many questions to ask because you're nervous. It's not like your normal home country where you do all these things, but then I assure you that it's nothing difficult now. Just like your home country, whenever you want to apply for a job, what do? You prepare your CV. Your CV should be tailored to the qualification and requirements by your prospective employer. That's the same thing that applies here now. In the case of healthcare assistants, you're set to have 1 or 2 experience related to the job, but then if you don't have, like I said earlier, it is not a problem because you obviously the trained for that job. But then if you have the experience and you have a qualification to back that up, that is a plus. Now what do? You want to have little experience from your home country before you come. So why don't you attach yourself to a hospital? Or there are some care homes, I'm sure, like in Nigeria, like in Lagos and Abuja, I'm sure of a few care homes, but I really can't remember their names, but I know they are. But if you make your research, you'll find them. Attach yourself to these places, work with them for like 3 months, 6 months, and get experience. Add it to your CV. Now, the reason I'm saying that is, if Mr. A and B is applying for the job and Mr. A has more experience than Mr. B, who do you think the employer is going to look at? Obviously, it's Mr. A. And then there are some organizations affiliated to institutions here in the UK that give trainings for this, and at the end of the day, you get qualifications. If I were to be you, it's just 3 months, 13 weeks. Why don't you get this qualification for a fee? Add it to your CV. That's a qualification and that's an experience joined together. And I'm very sure that they also help you with job opportunities. So I'm going to pop the link to this organization in my description box so you can check it out at your own time. Get a qualification, get the experience, and add it to your CV. Let your CV be packed and tailored to what is required, and then you can submit it to as many agencies as possible, many organizations as possible, and lo and behold, 1 or 2 agencies going to call you, interview you, and my girl, my friend, you're going to get this job. It's that simple. Yes, it's really that simple. Don't worry yourself. If you have any questions, just pop it in the comment section and I will try my best to answer. But please, don't forget that when you're trying to get a job, it's not only the agencies that offer the job. Sometimes you can get a job direct. Now, why I'm saying that's because I have so many doctors around me. Many of them went through agencies, and a few of them, or many of them too, got it direct. You can just search for jobs on the internet and then submit your CVs, and then they call you. But then drafting your CVs too is not the way we draft it in Nigeria. It's not the way we draft it in Nigeria. Sometimes submit your CV, you're adding like 10 copies, 10 pages, 5 pages. Hello? No. Very simple. Okay, let's say you work as an accountant, you worked as What else? Receptionist, you worked as a banker. Now, these are what you've done. What are we looking for? Healthcare assistant. What have you done to this regard? Draft your CV so that the focus will be on the HCA and not on the other things you've done, because they're not recruiting you as a banker, you're recruiting as a healthcare assistant. But don't forget that if you do not have any qualifications, also okay to apply. I don't know how you tailor your CV to that regard, but then I'm going to get a link on how to draft your CV. That's the UK standard. I'll pop a link in my description box. Check it out, draft your own CV, and please spread your tentacles. Submit CVs here and there, and I hear from 15th of February 2022, that is when it's open. So there'll be more organizations offering that certificate of sponsorship. Yes, girl, certificate of sponsorship, which is the big deal that we are all looking for, where you get to come to the United Kingdom via the health and care visa scheme. Now, when you submitted your CVs and then an organization calls you for an interview, sometimes, you know, when you get the interview, it's almost assured that, oh, you're getting the job, but don't get it twisted. You should have their requirement. Another requirement I know they notice that they ask for is driving license. So in Nigeria, if you have a driving license, usually you can use it for 1 year in United Kingdom. Then after that, before you go for your driving test and get their own license. So if you have your license, good and fine, that's a plus for you. And some of them require a car, require that you have a car, because you're going to move in from one place to another. Yes, coming to another country, you don't have a car, well, that's a problem. But I understand you're being paid, some organizations I've seen that they pay 45p per mile. So it's not like you're wasting your fuel, but you know, just helping you to move from point A to point B to point C to make your movement easy and swift. But then have your license, have your license, very important. Okay, so like I was saying, when they call you, it's almost as sure like you're getting the job, and then you're doing your interview, you know, they're asking you a few questions, and obviously, you know, in their questions, rather the interview question is like, they're asking you questions based on the experiences you have garnered over time. So if you have that experience and they ask you, this is this, obviously you should answer, this is this, that is that. Just be confident. Tell yourself, this is for me. I can do it, I will do it, and then it's yours. Now you've done your interview and all of that, your experience, everything's intact, then the big deal. Hello, they have given you the job. Giving you the job. Yes, they're giving you the job. Now what's the next step? They send you forms, various forms to fill. When you fill all the forms, the next thing is for your certificate of sponsorship. It will now be sent to you. Now the COS basically is a reference number which you're going to add when you're filling your visa form. So when you get that, now you have to apply for your TB test, and to the best of my knowledge, TB test is usually done in Abuja and Lagos, because I did mine in Abuja, so I'm very sure the center in Abuja, my friend it has in Lagos. And then after that, you need a police clearance. Clearance is any official document that serves as a check by the police to be sure that you don't have any criminal record, you know, because as an applicant, it's very important by the other country to be sure that you're free from any criminal record. So in any other country, if you've stayed for up to 12 months, like for example, if you stayed in South Africa for like a year, 6 months, you need police clearance for South Africa. If you stayed in Ukraine for more than 12 months, you need police clearance. And I'm not too sure, but then I know some persons, when they got their police clearance for other countries aside from their home country, they also got for those particular countries in Nigeria. So you have to make your own research, or I will also make further inquiries from people I know that came in and then they stayed in other countries too. So I'll find out from them and I'll get back to you on that. But I know that you need your police clearance. It's very important. Please stay away from crime. Be cool. Me, I'm begging you, stay away from crime. It's very important. So when you get your police clearance, your TB test, now you can also apply for your visa. They've taken off some fee from it, so you don't have to pay the full fee. Let's say for instance, so like £210, maybe you might end up paying for £150. Yes. And then the health surcharge, which usually you're supposed to pay every year, because you're coming via the health and visa care scheme. Hello, you are not paying that. That's why I'm telling you that this is a big opportunity. Utilize the opportunity, apply. See, after this video, just start drafting. When you check the link, start preparing your CV. Those of you who already have health background, those of you who already know a bit about the care home, like their responsibility, please pack your CVs right now. You don't have to wait, because this is going to last for 12 months. We don't know if it's going to be extended. So utilize every opportunity you have right now. I love a few of you from here to be among the people that are going to get this job. You know, it's just something. Just get it. Just do it. Like my own thinking. By the end of the day, the choice is yours. So just do what you have to do. And then maybe in my next videos, I'll be bringing out a list of credible agencies that I know and have contacted that are giving out certificate of sponsorship. Although there's one that I've seen that's giving certificate of sponsorship overseas, I'm going to pop it in my description box. So if you are ready for the job, please apply to that agency. They are in London. So in my next video, I'll get you a list of like a concise list of agencies that are giving out COS with regards to the healthcare assistant. So please utilize the opportunity and make it count. And if you can also go for a certification course, why not? Go for it. Pay the fee. At the end of the day, you're going to get your money back because you're here to work and not here to school. So that's basically it. If you have any question, please don't forget to leave it in the comment section, and I promise to get back to you. Or you can send me a DM on my Instagram handle at Miss Maki, and then I'll also get back to you. And I think so far that is it. It's that easy. It's not difficult. So don't stress yourself like, oh, it's in the abroad, oh, this and that. No, it's not in the abroad. It's a foreign country, yes, but they also do things like you also do things in your home country, that maybe they're a little more organized and all of that. And like I said earlier, you can get a job direct or through via an agency. These agencies are not like the agency that will come and tell you, hi, you need to pay this amount of money for me to help you get a job. No, these agencies are paid by the employer. Like for example, I'm an agency, and then you come into me, I advertise, and then you submit your CV. I'm not expecting you to pay me. Now, the employer, your prospective employer, is going to pay me that fee for bringing you into the organization. So when you see any agency that tells you, pay me £2,000, hello, please run away. That's a red flag. That's it. And with regards to the agency, for you not to fall scam, every agency has a website. Every agency has a physical place where you can work into. So if they don't have any of that, please, I beg you, don't be desperate and then go and waste your money or do something you're going to regret. Ask questions is very, very important. So that being the case, I'm sure I've answered a few of your questions, and any other thing, I'm going to pop it up as time goes on. Like I said, make hay while the sun shines. So see you guys in my next video. Bye for now, and please don't forget to subscribe and share my video, because I'm sure someone out there is going to find this piece of information very, very useful. Please share my video, and above all, give me a thumbs up. See you guys in my next video. Bye.